this might be political suicide here, what I'm about to say.
That preface from UCP candidate for Livingstone-Macleod, Chelsae Petrovic, mayor of Claresholm and a nurse, suggesting if you have a heart attack, you should take personal accountability.
Maybe the reason why you had a heart attack was because you haven't taken care of yourself. You know, you're extremely overweight. You haven't, you haven't managed your congestive heart failure. You haven't managed your diabetes, and there's no personal accountability. But they come into the hospital, and it's all of a sudden it's everyone else's problem but their own.
While political scientist Wayne Brad agrees personal choices do lead to health risks, he calls Petrovic's comments tone deaf.
Anytime a candidate on the eve of an election begins by saying this may be political suicide, that should be a hint that you should stop talking. But she continues.
He questions what healthcare policy outcome Petrovic would like to see after she makes her point.
Should they say, yes, you had a heart attack, but you're fat, so we're not going to treat you, or it's your fault, or we're going to extra bill you?
Bratt says this was a debate during COVID.
Whether those unvaccinated catching COVID going into ICU should be treated or not. And that was roundly condemned for even thinking about that. This, I think, is the same thing.
In a statement to Global News, Petrovic says in full, this comment was taken out of context. I was speaking for several minutes about the challenges in our healthcare system is currently facing, not only as mayor of Claresholm, but as a frontline nurse. I understand my comment could be offensive when removed from the longer interview, and I should have chosen better language. I believe we should be a province that not only focuses on reactive health for those in need, but also one that teaches our kids to practice healthy living, which includes taking care of our physical and mental health. Save Kaiser, Global News.